My name is Taylor Halsey, and I did my policy analysis over the 21st Century Cures Act. The act was introduced as a chance to transform the way disease is treated in America. On January 6, 2015, by the U.S. House of Representatives Energy and Commerce Committee. The bill was passed by the 114th Congress with bipartisan support. 90% of major political party individuals of Congress supported the passage of the bill. And then on December 13th, 2016, President Obama signed the 21st Century Cures Act into law. The bill is divided into 3 different sections. So Division A, which is the 21st Century Cures, addresses the opioid epidemic, the National Institutes of Health reauthorization, and the drug approval process changes to the U.S. Food and Drug Administration. Division B, helping families in mental health crisis, incorporates various aspects of different mental health pieces of legislation that have been through Congress in the past couple of years. And Division C, increasing choice, access, and quality in health care for Americans, involves changes to Medicare. The problem that the 21st Century Cures Act addresses in Division A and B can kind of be summed up in 3 different categories: the opioid epidemic, changes in the Department of Health and Human Services, and mental health care. Okay, so for the opioid epidemic, last year 19,000 deaths were due to prescription opioid overdose, which is equal to 50 deaths a day. The majority of non-medical opioid use begins with a prescription. Some people are looking for the euphoric effects of an opioid, but some are trying to manage pain and don't want to stop taking the opioid because they'll experience the withdrawal effects. Some previous policy has aided in the epidemic. The Federation of State Medical Boards went as far as to ask state boards to create policies that would punish doctors who were under-treating pain. And this resulted in an increase in prescription opioids. Prior policies focused more on heroin use, such as the war on drugs, and this just created a disproportionate consequences for minorities. But the prescription opioid epidemic has increased media coverage to white privileged American drug use, and so that's increased awareness of the problem itself and policy to address it. Millions of Americans are diagnosed and eventually die from Alzheimer's disease and various forms of cancer without the chance of a cure. The National Institutes of Health work to find cures for these diseases and other diseases that have not found cures. The only problem is a lot of times there's not appropriate funding, and if the NIH does find appropriate funding, there's a lot of red tape. For instance, the Paperwork Reduction Act, despite its name, created a lot more paperwork and things, and so it takes much longer for research to really get started. As for the FDA, the approval process is the fastest in the world, but the drug development phase is less efficient. It's even been described as costly and slow. The Community Mental Health Centers Act deinstitutionalized mental health care, and this was a beneficial shift to those with a mental illness. However, there needs to be a balance of care. Inpatient care is hard to find, and community centers are not always equipped to competently treat all levels of acuity. Many with a mental illness will encounter the criminal justice system in one way or another, and interventions like the mental health courts are in place without a solid evidence base, which keeps these interventions from being used everywhere. So interventions instead of or alongside incarceration can reduce recidivism. description of the policy. So funding, what keeps the 21st Century Act relevant? The bill eliminated the Prevention and Public Health Fund and the $3.5 billion associated with it. So money from this fund, along with money from an oil sale from the Strategic Petroleum Reserve, makes up the budget for the bill. Over a 2-year span, the bill allocates $1 billion in grants for states to respond to the opioid epidemic. And the FDA will receive $5 million over 10 years. And the NIH will receive $4.8 billion over 10 years. Division A reauthorizes the NIH through fiscal year 2020, and a great deal of improvements are made involving cutting through red tape to reduce the administrative duties on researchers. Other changes include the support of young and minority scientists, an increase in secure data sharing among researchers, and privacy enhancement for those volunteering for research projects. The bill encourages the FDA to use more short-term trials over large randomized studies. It also recommends the use of surrogate endpoints within studies to predict outcomes, especially for drugs that can treat serious conditions. Investigational drug access will be accelerated for individuals with a serious condition. Patient experience data will also be used to evaluate risk and benefit of a new drug. Division B, which deals with the issues within mental health, the initial portion of the bill involves leadership and data collection responsibilities of the Substance Abuse and Mental Health Services Administration. The bill continues with other responsibilities of the administration, including implementing policy changes relevant to mental health issues, circulating and evaluating information regarding evidence-based practice, and improving services for veterans. The 21st Century Cures Act also allows for grants through fiscal year 2020 for regional and national needs. These grants cover a wide variety of things. Some of them include suicide prevention in adults and youth, an inpatient bed availability database, increased services for homeless individuals, and early childhood promotion, and addressing the needs of mothers with depression. The Department of Justice, there's a lot of changes within there as well. Some of them include determining the effectiveness of diverting individuals with a mental illness in the criminal justice system to mental health courts, training law enforcement and prison personnel on aspects of mental illness, residential treatment programs for state prisoners, and re-entry projects prioritized to treatment and transition for those with a mental health or substance use disorder and the homeless. So Division A and Division B have different goals. Division A's goal is to make the NIH and FDA more efficient and effective. It hopes to increase the likelihood of new treatments and cures by providing optimal conditions. The goal is to improve government systems so the health of the American people can improve. While Division B's goal is to improve the mental health system and the knowledge base informing services that are associated with it. Various levels of service are being aided for a variety of populations. Changes within the Department of Justice have a goal of reducing recidivism. As for unintended consequences, most of these have to do with the changes within the FDA. Negative drug consequences may not appear in short-term trials, and so this could end up benefiting pharmaceutical companies more than the public. Medications are priced by demand, and so as if a short-term approval process is used, pharmaceutical companies won't have competition as often with generics and can continually provide new drugs that can be sold for higher profit that are poorly tested. These unintended consequences have created some opposition. The consumer advocacy groups, Public Citizens Health Research Group, and the National Centers for Health Research believe that the 21st Century Cures Act will weaken FDA standards and threaten the health of society. Senator Elizabeth Warren looks at the bill kind of along the same lines, thinking that it'll decrease drug safety and that it was only passed due to pharmaceutical companies having too much input. The global comparison. The European Medicines Agency is the EU's version of the FDA. They evaluate drug safety, but their standard for accelerated approval is higher than that of the FDA. Ideology. The ideology of the 21st Century Cures Act has a positive look on Americans and their abilities. It sees that people will want to search for cures and treatments and mental health interventions and will be able to find them. It sees the nature of society is one that wants to help each other. The government funds research and limits restrictions. It gives society the tools to fulfill the policy goals and then steps back to allow members of society the chance to fulfill them. There's been a limited amount of policy around mental health in the past, and so each act shows a lesson from the policy before it. So before the Community Mental Health Centers Act, policy was focused on creating care in hospitals, and then when the Community Mental Health Centers Act was created, there was a focus on deinstitutionalization. And now it's a focus on balancing the care and finding appropriate care at multiple levels. The 21st Century Cures Act is still relatively new. It hasn't been in effect for very long. And so knowing exactly what's going to happen with the bill isn't really, we don't know. So it's important to continue to advocate and work for changes and continue to show that these changes in mental health are important and necessary, so that way they stay. And differences.